Hello, this is Mrs. Preston. I am offering 432 students a pre-brief so they know what to look forward to when they come for their OSCE. So what is expected? Well, you will get a short background on your patient. It may contain some lab values or diagnostic information, but it will offer you just enough information for you to complete the task. Your scenario will only be about 15 minutes, and then it will be followed with a 15-minute debrief. It is truly designed for you to show off your critical thinking skills. Ask subjective questions. What is pertinent? Why are you asking specific questions? You really want to look at their background. What are their lab values? Why are they in the state they're in? So I'm looking for you to match content that you're going to hear from your patient to objective data that you're gathering. And also, we are looking for a full assessment. This is not a focused assessment. You really need to look at every piece of skin on your mannequin. Except his back, he's too heavy. So don't listen to, you don't have to move him around in the back. To back up just a little bit, so I'm looking for, when you're gathering that subjective information, relate your patient's history to their current state of health. I'm looking for you to put the pieces together. I have these laid out directly related to content and theory that you have learned. So performance in your scenario and your debriefs both matter. So if we have that 15-minute scenario and something kind of pops into your head, talk about it. That's what we're really looking for, is for you to pull all the pieces together. So full assessment. Do not listen to the lungs or bowel sounds over the gown. That's my biggest pet peeve. You never want to do that with a patient, so please don't do it in sim. And in addition to that, you're not looking at their skin. So you really do want to look everywhere from head to toe on your mannequin, but focusing on the most important things. So you also want to know, why are you focusing on bowel sounds on this patient? Why are you focusing on lung sounds? Why are pulses important? And just really piecing it back to your patient's background. If there is a medication to administer, I need to hear and you to verbalize those rights out loud at least one time. It could be a double check with your partner. It could be verbalizing it to your patient. Just need to hear those exact rights out loud. And then if you do any teaching, evaluate your teaching. You can do teach back. You can ask your patient, please help me. I want to make sure I did a good job teaching you, this information. Can you help me? Maybe tell me what I, did teach you, so I made sure I did it right. However it works best for you. How will you be evaluated? Creighton Competency Evaluation Instrument. This is uploaded in D2L. So 4 areas, and this is very clear. I'll give you a short, overview of what for each. Assessment, pertinent data. That pertinent, I couldn't be more focused on that word. Why are you collecting data on your patient specifically? Follow-up assessments, absolutely. If you put oxygen on, recheck that oxygen level. What intervention did you do? Did it actually work? And then assesses the environment in an orderly manner. So really that's looking at everything. If you're doing your physical assessment, you are assessing in a strategic way, and you have a flow, and you're not jumping all over the place. Communication, absolutely. If you have to take an order, you do your read back, communicate with your partner back and forth effectively between the patient and significant others. So any sort of teaching, just like in teach back, that sort of thing. We don't do a whole lot of documentation, but if I do offer documentation, I really want that to be clear, concise, and accurate. Responds to abnormal findings appropriately. And that's really the N432 level of thinking, is to be able to understand what's normal versus abnormal and when you need to react. Professionalism, that's a given. Interprets those vital signs. I want to see that applied to your patient condition as well as lab values. And then again, relevant versus irrelevant subjective and objective data. That defines the entire N32 level of thinking. Prioritization, evidence-based interventions, understanding why you're doing interventions, all can be revealed in debrief, and then evaluating that as well. And then reflection is I just couldn't say how important the debrief and reflection is. Ask good questions. Ask your partner, why did they decide to do one thing or another? Delegation, all of these can be rated as 0, 1, or not applicable. There might be delegation appropriate, there may or not. And safety really goes in any clinical skill you do, any medication you administration. So your patient safety has, all of those things pulled together. So that's how you be evaluated. And again, I'm looking for that for the specific 432 level of thinking. What can I use to help me? Ask your partner. If you're not sure of the lung sounds and you really just want them to double check, Ask for a second opinion. I'm looking for you to understand, why might their lungs sound like that? If they've got pulmonary edema, you might hear crackles, but it's for the understanding of, I don't hear what I think I'm going to hear, and that just is exactly what I'm looking for. You can bring resources, or medication book anything you would use on the floor. There will be an IV medication book in the room if you do need that. Vital signs are all going to be on the monitor, except the blood pressure. It will be there. You don't have to take it manually, but if you see a blood pressure on the monitor, assume it is old. Just like on a Dynamap, you need to push start, stop to get a current blood pressure. The temperature is also accurate on that monitor for you. Okay, so just a few words on the mannequin. So if you have to administer IV medications, IV fluid, IV access should be treated just as a normal patient. If it's a saline lock, I want to see you flush, administer medications, or hook the IV fluid up just as you would a real patient. So there's no verbalizing and just saying, I gave the med. So there's no pretending. You want to administer it just like you would. Really focused on IV medications for this particular ASCII, or IV fluid, IV pumps. You want to be very proficient in them. And so then another thing is if you need to add oxygen or administer oxygen with a nasal cannula, it makes students crazy because the poor guy doesn't have any ears. So if you use it like a lasso and cinch it behind his head rather than under his chin, it makes it a lot easier. Heart and lung sounds are accurate. Pulses can be assessed. They're a little temperamental. So if you don't push completely down, if you push just softly, you're going to be able to palpate this pulses much easier. So, this is the most important slide of this presentation, is that there are no tricks set up in these ASCIIs. It is completely set up designed to allow you to show off your skills. No tricks, no discrepancies like date of birth or purposeful mistakes in dosing. These are designed specifically with content from theory in mind that I know that you learned. I'm just looking for you to be able to apply it to that clinical situation. So looking for those skills, ask appropriate questions to your patients, administer medications correctly, and understand why those patients are getting those medications. What do you need to teach them? Are you evaluating if they're working? All of those things, can be verbalized and during the actual simulation and in debrief. Any equipment safely, that's IV, that's tubing, that's pump, that's everything as far as equipment goes. And these are all things that you've been doing on the floor all semester, so no new surprises. My goal is to set you up for success. I want to see everyone succeed. I just need you to be where you need to be before you advance to the next course. And I think we're all on the same page with that. CET expectations, reflection only, do not self-score or write to objectives. Really just need to see your own genuine, true reflection about your performance, how you genuinely felt. We were both there, and the things that you really excelled and succeeded. Were you surprised? Were you not? What did it for you? Were you feel like you were better off, or were you really mad at yourself that you felt like you could do better? And talk about the things that you were able to piece together during the scenario. And any documents that you were required to submit along with your CET need to be uploaded. You'll get instructions on that the day of the ASCII. Points will be deducted if this is not done, so please do upload anything that's been assigned. And, lastly, I just need you to relax. I need you to be able to relax and come in and show off your skills. Know that I'm on your team. I want you to do well, and I can't wait to see how well you do. So relax, come in, and do well.